For my fifth topic, I chose therapeutic communication because it represents a skill I know I will rely on constantly in my future nursing practice. As someone who values patience and empathy, this topic felt like a natural fit. I want my patients to feel understood and respected and feel that they are at the center of their own care. This topic helped me understand that both the challenges and the opportunities that come with communicating effectively in a healthcare setting. My research helped me move from just knowing what therapeutic communication is to actually understanding what it looks like in practice. From the Alchemy et al. Article, I learned that communication with older adults requires intentional, evidence informed techniques. They highlight specific skills like active listening, validating emotions, and asking simple and direct questions, and giving patients extra time to respond. Their emphasis on simulation based training showed me that communication skill isn't instinctive, it's a skill nurses must practice and refine. And the second article, Alcafol et al., reinforced how essential these skills are by examining barriers. They found that things like language mismatches, environmental noise, and rushed interactions can break trust and make patients feel unheard. Their work reminded me how small actions such as sitting at eye level or using calm tone or clarifying messages without judgment can transform the patient's sense of safety. What both articles make clear is that therapeutic communication is not just talking. It includes techniques like open-ended questions, reflecting back to what the patient has said, sharing observations, and allowing silence so patients can process their emotions. These skills align directly with what we've learned in class, that communication is purposeful, relational, and requires presence, empathy, and curiosity. To connect the therapeutic communication to the pillars of health, I think that if my pillars of sleep or stress management aren't fully attended to, I do run the risk of not engaging with my patients in therapeutic communications, and that ultimately I lower their quality of care. So it's important for me to maintain those pillars so that I can care for my patients effectively. So just as a lingering question that I still have, I'm just wondering, how do nurses sustain effective patient-centered communication in high-pressure environments where patient loads are high, stress levels are high, and you can't really talk with your patients in a way that you would like to? I just would like to see some sort of ways that practically nurses do it. And then just as a quick final reflection for this topic, I think that as I move towards my clinical practice, just thinking about this therapeutic communication and thinking that it's more of a skill and not just an inherent ability that I should have is very reassuring. I am a bit scared of going into clinical and not being able to talk to my patients effectively, but knowing that I can reflect and build these skill sets up so I can communicate with them effectively and provide them good care is somewhat comforting.